Good afternoon, everyone. I am Dr. Noelle M. Dominguez. I am a practicing general pediatrician and a pediatric pulmonologist. I have clinics in Cebu Doctors University Hospital and Chong Hospital, Mandaue. Hi.
What common problems do doctors face with manual record keeping?
Okay, so one concern that we have is that aside from the paper charts occupying space, is that most often doctors will have clinics in other locations, and let's say that patient goes to clinic A, but there's a time that they may need to follow up in clinic B because of some scheduling concerns. So if we use a paper-based medical record, then it would be kind of difficult to recall what was written in the patient's chart in your other clinic, right? So I think that is one disadvantage of having paper medical records.
Which SugboDoc features do you find most useful in your daily work?
Okay, so I find it useful that it is portable, meaning if I have two clinics, then one patient may shift back and forth to those two clinics. I can easily access their record. And also I can upload files, especially for my practice wherein we view chest x-ray films. So I ask the patient to bring their films and I take a picture and I upload it. And one good feature is that I can do annotations on those photos. And I also like that I can now upload the growth charts and plot each weight and length recorded per visit without having to resort to a paper growth chart. And also I can renew prescriptions. That is useful for me, especially if I have a patient on maintenance inhaler medications. I may not need to retype the brand or generic name. I will just have to edit the frequency or the dose, then just print. And speaking of printing, then the prescriptions can now be easily read for both parents and the pharmacist. So at least there would be fewer or no mistakes at all in the administration and dispensing of drugs or medications.
What challenges from your previous EMR did SugboDoc
So
solve?
my first challenge was that the age of the patient was not immediately displayed when I go to the patient's homepage. I have to go back to one page backward to check his or her birthday, that one. And then the second challenge that I had with my previous EMR was that I could upload files or photos, but I could not edit on that file. Meaning, for example, I would like to have the growth chart of a patient to be uploaded, and then per visit I will have to plot their weight or height or head circumference. So in my previous EMR, I could not do that. So I had still to resort to using a paper growth chart so I can plot it manually. Yes. And the third issue that I had was that I could record the vaccinations that I administered to the patient, but during the time that parents will ask for a summary or a vaccination certificate, I had to retype everything from the name of the vaccine to the date given and the lot number. So I had to maybe use the Word file or an Excel file to type that certain certificate. So it also took some time. Yeah, that one.
How has SugboDoc made your workflow and patient management better?
In terms of the workflow, I think it's now it takes shorter time for looking for records, searching for a patient's record is just very quick with just a few types on the keyboard. And also, it has improved in such a way that the patients can be notified via text. It has improved by making sure that they are up to date with their follow-ups and vaccinations. Yes.
What advice would you give to doctors unsure about cloud-based EMR systems?
Okay, so for all those who are still using paper, think of Mother Earth. I just don't know. Just think of the clutter that you can get rid of when you shift to an EMR, and your workflow becomes more efficient because searching for patient records has been already cut short, and the data of your patients are actually secure. So I am assured of data privacy and confidentiality.